This patient was referred to us for examination and evaluation of tooth number 3. According to the patient, this root canal was done a few years ago. And recently, she noticed a pimple on her gum. Tooth is also tender to biting and chewing on. This was the clinical presentation of the tooth. That's the tooth here, and you can see a sinus tract right there associated with the tooth. Tooth was tender to percussion and palpation. Probings were 6 millimeters here, and the rest were 2 to 3 millimeters. And take a look here. So you can see a previous root canal. That's a post, prefab metal post, but take a look here. Look at the post and how much dentin is left here on this side. And again, you can see a J-shaped periapical lucency. Single deprobing, J-shaped periapical lucency, prefab metal post. Look how much dentin was removed. Short fill, of course, but short fill doesn't mean anything. Look at how short the fill is here. The palatal canal, and look, no periapical lucency. So the extent of obturation, remember, Dr. Lin's study, the extent of obturation does not have a negative effect on the outcome of endodontics. What affects the outcome of endodontics the most is whether or not there is bacteria in the canals. Whether or not bacteria are present in the canals. So, you see how short this fill is? No periapical lucency. So, when you prep a tooth like this and you put a fat, short post in it like this, and look how much dentin, how thin the dentin is here, over time, this mesiobuccal root cracked, vertical root fracture. Unfortunately, tooth needs to be extracted. So, it's called the science, the arts and science of dentistry, the arts and science of endodontics. Science, emphasize on science. So if you don't know the science, you do work like this and you get failures like this.